Hello and welcome to the Road to Nowhere channel. For those of you who haven't been here before, my name is Poppy Rowan and I'm actually going to get stuck straight into today's content as we do have a lot to get through. Today's video is in line with my previous training in the QPR Institute. For those of you who don't know what that is, it stands for Question, Persuade and Refer, and you can find out a little bit more information about that on the previous One Sentence Spark videos. And these also include basic information about how to become a QPR gatekeeper, some useful tips for your own mental health and well-being, as well as some information on how to support the people around you who may also be struggling. So just a little bit of a trigger warning, I will be talking through some very sensitive subjects today. A massive part of the QPR gatekeeper training is to recognise the warning signs of someone who is contemplating suicide. So if that is a particularly sensitive subject to you, I would advise maybe having someone on standby to speak to afterwards, just in case you need some support. So who or what is a gatekeeper? Well, basically a gatekeeper is anyone who is in a position to recognise the warning signs that someone may be contemplating suicide. As said before, as a gatekeeper we are not counsellors or therapists, we are there to act as the buffer zone between the person seeking help and actually receiving the professional help. We are there to question them if they are feeling suicidal, which again we will actually go through that in a few videos time, is how to question someone if we do believe they are suicidal. It's P, persuading them to not act on the thoughts that they may be having and persuading them to actually seek the professional help they may need, and R, referring them to that competent care provider. So before I go through some of the warning signs, I would like to go through some myths surrounding the subject of suicide, and number one being that men are more suicidal than women. Now, statistically, this may seem true as more men have died from suicide than women. However, this is not an accurate estimation of attempts. It's important that we look after everyone equally, of every gender, background, age. Anyone could be struggling with their mental health or be struggling with suicidal thoughts, and it's important that we recognise that anyone can need help at any point. So myth number two, if they need help, they'll ask for it. This is completely false. In fact, most suicidal people tend not to self-refer, they tend to resist treatment, they hide their level of despair, they go untreated and undetected. So if you do think that someone is suicidal, don't wait for them to ask for help. Ask them, question them about it, and try your best to help them or refer them in any way you can. And myth number three is the statement of they or I am past the point of help. So there is no such thing. There's always someone or something that can help, and it's important that the person who is contemplating suicide knows this. You never know what's around the corner, and it can just take one sentence to completely change your whole mindset. And we will go through some of the one sentence sparks and some advice that you can give to someone who is feeling suicidal in the next video as well. So before we move on to the warning signs, I would like to talk a little bit about overcoming our own personal reactions to suicide. So by recognising the suicidal person's cry for help, you are offering hope and you're persuading them towards more positive action, you're preventing a life being lost. But obviously, first of all, you do need to get over that initial shock and whatever other reactions which you're totally entitled to before being able to offer that person help. So the idea that someone wants to die is obviously frightening, however fear does lead to denial, and denial is how we cope when we are hit with something that's too terrible to even comprehend. We convince ourselves that what we have heard wasn't right, we deny the warning signs of a suicide crisis by telling ourselves, well, people who talk about suicide don't do it, or that the person is only seeking attention. But the fact is that people who talk about or threaten suicide often do go on to attempt or die by suicide. For many of us, we first of all have to try and overcome our reluctance to become involved in that situation. Obviously, we don't want to say anything which may harm that person further. But too often we are in a position to recognise those warning signs and fail to do so because we deny or minimise the seriousness of the situation, and that's completely fine. That's your own reaction. It's completely normal. We want to now try and understand how can we overcome that so that we can help that person, because unfortunately for the troubled person who is emitting these signs, if we fail to respond or acknowledge them, they can sometimes take that as a sign of, well, they don't care anyway, and they can almost take that as permission to carry out the thoughts that they may be having, unfortunately. So just another little trigger warning that some of the following statements may be upsetting or distressing for the viewer. Please do watch with discretion, or if you feel it may be too much of a sensitive subject, please do watch with someone. So research shows that the majority of those who attempt suicide give warning signs, particularly in the weeks preceding the attempt. These warning signs can include written, verbal or behavioural signs. And one or two of these signals may not seem like a big deal. However, anything that indicates a feeling of hopelessness, despair or worry about the future is definitely worth asking about. A behavioural sign can include a relapse into drug or alcohol abuse, or it doesn't need to be a relapse, it can be a sudden dependency on those things. It can be stockpiling pills, putting personal or business affairs in order, making or changing a will, giving away money or prized possessions, a change in behaviour, especially hitting or screaming or not being able to get along with friends and family when they used to be able to. Suspicious behaviour, so going out at weird times, a sudden interest or disinterest in church or religion, or a loss of physical skills, so general confusion or a loss of understanding, judgment or memory can be a good indicator of someone who may be contemplating taking their own life. A situational clue, so something that could happen in their physical life which could lead them to have suicidal thoughts, is sudden rejection from a loved one, so breaking up with a girlfriend or boyfriend, a recent move, especially if it's unwanted, a diagnosis of illness, a sudden loss of freedom, so being arrested, a flare-up with friends or family for no reason, loss of financial security, or the loss of a cherished family friend or loved one, or even the loss of a cherished therapist or counsellor can also trigger that. So as well as these examples that the QPR Institute have written for us, you will also have your own instincts to fall back on as well, particularly if you know the person that you may be a bit worried about. You don't need to put these skills into use just for people you know. They can also be for people in your work that you come across, people that you've just met. There's never a time to be off duty when trying to recognise these warning signs. This can be quite a heavy burden to have on your shoulders. Please do watch some of the other One Sentence Spark videos where I do talk about how to help other people without letting it affect you personally. Please look after yourself and the people around you, especially in the crazy world that we're living in right now. Just stay safe, stay kind, stay positive, and I'll see you in the next video. Thanks so much for watching. Don't forget to like and subscribe. It really spurs us on to continue to make these videos, which hopefully are helping a lot of people. Thank you so much.